My name is Aditi Muthukumar. I'm extremely excited and honored to be presenting to you about the increased consequences of cannabis legalization on the developing teen brain. But first, I'd like to introduce myself a bit more in detail. I'm a rising sophomore from Westminster, Colorado, attending Legacy High School. I am very passionate about community healthcare, especially mental and behavioral health outcomes for youth. I am an active member of my school community as the president of my school's Science Olympiad and Model UN chapters. I also serve as a youth researcher with CU Anschluss's Youth to Youth Empowerment Project, which focuses on improving behavioral health outcomes for youth in the Denver metro area. I also serve as a volunteer in the labor and delivery ward at a local hospital. I'm very interested in the associations between technology and healthcare. I recently won a congressional commendation by developing the Safe Space app, an application to assist teenagers in managing their own mental health with safe, easy to use, and credible tools, as well as making informed decisions about substance use. So now let's begin with the few statistics. 40 out of 50 US states have legalized cannabis for medicinal use, and 24 out of 50 have legalized it for recreational use. In areas of Colorado, the state I live in, using cannabis is more legal than snowball fights, dandelions, and even running chickens. And while this may sound a bit absurd, this statistic reflects a serious shift in the normalization of cannabis use in today's society. Several other countries, including Canada, Mexico, and Thailand, have made the legal decision to legalize the recreational use of cannabis. So while this decision does have its pros, such as safer regulation of the drug without associated criminal consequences, potential therapeutic effects, and reducing drug trafficking violence, the connotation associated with legalization can be dangerous, especially for adolescents. And this connotation is legal is safe. This is furthered by increased social media advertisement, which is associated with higher use in teens, as well as an emphasis on youth-appealing branding. For example, products with cereal milk flavors and popular candy-adjacent branding marketed towards youth are often placed in weed dispensaries. This is a significant and important global health issue because it shows the interconnection between public policy and behavioral health outcomes through a movement that is spreading rapidly across the world, and it affects adolescent exposure to potentially harmful substances. So in this presentation, I will explain the developing adolescent brain, how cannabis impacts brain development, and the decisions that can be made to resolve this issue. So the brain doesn't fully develop until around age 25. And in the meantime, it is busy strengthening neural connections dealing with memory and decision making, pruning unused connections, and developing the prefrontal cortex, which is most responsible for planning, judgment, and impulse control. So cannabis has been shown to be detrimental to these brain functions, especially in individuals who start heavy recreational marijuana use before age 16. They may perform more poorly on cognitive or behavioral tasks involving the prefrontal cortex, such as memory, attention, and judgment, than those who don't use cannabis at all or maybe started using it later in life. Cannabis also has extensive effects on school performance and intelligence in teenagers, causing them to get worse grades, make poorer decisions, and have worse memory. So to explore these effects further, I decided to contact two addiction science researchers at the University of Colorado Medicine Addiction Health Services Research Program, Dr. Jared Patel and Dr. Sukhmeet Sandhu, for their research and clinical experience working with adolescents and younger adults with drug addiction. I decided to first contact Dr. Patel about the long-lasting effects of cannabis use, and he explained that teen drug use can have long-lasting effects reaching adulthood, causing continued mental illnesses such as anxiety, depression, and sometimes even psychosis, affecting the ability to live a normal life and get a stable job. I also talked to Dr. Sukhmeet Sandhu about her clinical experience with teenagers. She essentially explained that cannabis use makes it so that students are affected in their ability not only to get good grades, but even to attend, due to health complications such as cannabis hyperemesis disorder, a disorder causing teens using cannabis to have severe abdominal pain and cyclic vomiting. It also affects the students' abilities to build meaningful relationships, causing them to unfortunately isolate themselves from friends and family. Therefore, while cannabis legalization can have various benefits in adulthood, cannabis use in adolescence leads to impaired cognitive function, eventually leading to poor school performance, increased absence, and poor decision making. While taking not only the benefits of cannabis legalization, but also the dangers that this movement may pose to teenagers into account, policymakers must balance both needs to inform the decisions they make surrounding cannabis use. So, to alleviate the risks posed to teenagers while still catering to the needs of those in favor of cannabis legalization, policymakers can consider the following, starting with stronger public health campaigns specifically aimed at adolescents to help them understand that just because something is legal doesn't necessarily mean it's safe, especially during such a critical period of brain development. Policymakers can also consider implementing stricter regulations around marketing cannabis products to youth, like cutting down on social media advertisement, changing suggestive branding to make products less appealing to youth, and in general, reducing the use of strategies that advertise to the youth demographic. Finally, they can consider investing in school and community-based prevention programs that not only educate teens, but also provide healthy alternatives, mental health support, and spaces to make informed, empowered choices. To conclude, while cannabis legalization certainly isn't a black and white issue and continues to spark debate around the world, it's essential to recognize both its benefits and its risks, especially for adolescents. While legalization may serve important purposes in adult populations, including regulated access and potential therapeutic uses, it brings unintended consequences for young people whose brains are still developing. The perception that legal means safe can mislead teens into underestimating the real, lasting effects that cannabis use can have on their cognitive development, academic performance, and mental health. By raising awareness and investing in our youth, we can support teenagers in making positive decisions for their health. Thank you so much for your time, and I hope this presentation encourages you to explore and think more deeply about the fragile yet powerful balance between policy and healthcare. Here are the sources I used. And I would like to acknowledge Doctors Jared Patel and Sukhmeet Sandhu for their valuable work in the field of addiction science and insights from my research. Thank you.